Hey, I'm Matt. I'm going to talk a little bit about Medicare and Medicaid fraud and how it's affecting taxpayers and the Affordable Care Act all over. First off, I'm going to just talk a little bit about the background of Medicare and Medicaid. Start off Medicare. It was enacted in 1966, and it is for the coverage of mostly older people past 65 and then those with disabilities that are under 65. And it's the nation's largest health payer program that we have in the state now. And on the other hand, Medicaid, it was enacted in 1965. It covers 72.5 services of people all over the country, and it is mandatory law for states to have Medicaid options. Medicaid also provides services for those poor Americans. It provides inpatient service, hospice, personal care, family planning, nursing facilities, and all that. Um, and then Medicaid and Medicare fraud. Fraudulent behavior became available after about 2012 when the Obamacare Act was enabled, and that is the unlawful billing of hospitals, doctors, nurses, claiming that they provided services that Medicaid and Medicare would cover. So they were receiving millions and millions of dollars, multiple states, for this coverage that was actually not happening. And today, I think it's about $50 billion each year that the government loses from these fraudulent behaviors. And the major players and the stakeholders in this, the ones that lose out the most are government spending and taxpayers that are pushing and pushing more money into Medicare and Medicaid system. Um, and then also like some of the stakeholders are the nurses and doctors that are um, writing down and claiming to have done these services on these lower income or older patients when really nothing has been going on at all. Why is this important? It's important because our health care system today is very, very high in spending, and Medicare and Medicaid, the budget was about $550 billion, and they're losing about 50 billion of that from Medicare and Medicaid fraudulent services that are being written down to have happened but not happened. So us taxpayers are actually paying more and more money for these things to be happening. Um, and there are things that we can do. I'll get to that in a second. But um, first off, courses of action and what should be happening. Medicare, Medicaid fraud, upcoding, unbundling, embezzlement are the first things that are happening, and we can actually provide that by setting up units that are actually Medicare and Medicaid units. They were all established in about 2007, and they operate in the biggest cities of where the frauds happen. Mostly Florida and New York City is where the majority of these fraudulent services occur. Um, and they recovered about $2 billion in 2012 from these fraudulent services. So we are actually losing tens of billions of dollars that are not being detected and not being noticed by this. Um, Courses of action, what we should be doing, I think that we should rewrite the rules of the spending that each state and service can get, because states are allowed on a state to state basis to allow more funding or less funding for Medicare and Medicaid. Um, Virginia, we have 100% of our lower paying or lower income persons on Medicaid, and it differs by state and political reason. These services are incorporating more and more funding. Um, so I think there should be a regulatory amount that each state can get, and so we can try to limit the amounts that each of these doctors and nurses are embezzling and are stealing from the government and the U.S. taxpayers. And also my other opinions on it, I think that first off, the Obamacare Affordable Care Act, it hasn't been very successful, and I think with this new presidential election, I think that we need to restructure it. I don't think we need to completely get rid of it. I think there are things that need major changing so that these things don't happen. But obviously, it hasn't been very successful over the past few years, and we do need to do something about that. And these fraudulent services are costing our country and our taxpayers millions and billions of dollars. So we do need to do something.